So welcome everybody. This is our final UT Pride Pop-Up Institute talk. Last but definitely not least, this is like the fireworks at the end. To remind everybody, or those who may not know what the UT Pride Pop-Up Institute is, we have been, over the month of October, convening community members, researchers, and subject matter experts to discuss the future of research with the goal of improving health and wellness for sexual and gender diverse people here in Central Texas and beyond. Two heads are better than one, and many, many little Zoom heads are even better. So thank you all for participating. We know that there's a lot going on these days. And that there is a bit of Zoom fatigue. So we are also recording these sessions, and they will be posted on our UT Library's website for the pop-up, which will live on after the pop-up is over. So I'm going to put in that link, and in the next few days, you can expect for this talk to be up and freely available. Just as a quick reminder, the talk will be recorded. So don't say anything you wouldn't want to, and please just message me if you'd like anything redacted. Please feel free to use the chat to ask questions. I will collect them and ask Dr. Parker at the end. And I'm going to hand it over to Dr. Stephen Russell, who is one of our pop-up steering committee members, to talk a little bit about a related report and to introduce Dr. Parker.
Thank you, Dr. Norwood. We cannot underestimate your incredible leadership in the last year for this pop-up. It has been fantastic. So everybody virtually clap and say thank you, Dr. Norwood, for bringing Pride front and center at UT, which a lot of us still were like, wow, that's so great. And thanks, Liza Scarborough, for your support of all that. And it's really fun for me to introduce Dr. Karen Parker. Dr. Parker is the director of the Sexual Gender Minority. I'm gonna have to actually look at my notes, make sure I say it right. The Sexual Gender Minority Research. What is it? I know it. I actually know what it is. Office of the Director of, anyway, something important in NIH, the Sexual Gender Minority Research Office. And it's funny because I thought of Dr. Parker as a cancer researcher person, because she was for a number of years at NIH in the National Cancer Institute, but then was reading, becoming more familiar with her bio, and saw that she studied English and social work before doing her Ph.D. in social work at University of Maryland. It was like, oh, right, that explains that Dr. Parker is really this person who has brought together the field. And I thought, well, of course it would be a social worker that would have done that for us. Dr. Parker joined the office, the SGMRO, in 2015. And the important history piece is that there was an important report released in 2011 on the health of LGBT populations in the United States. That report was released by the National Academy of Sciences, actually Institute of Medicine at the time. And the report made a number of recommendations which led to the establishment of the office at NIH that Dr. Parker now leads. And so that office was established sometime, well, maybe it was right after 2011, but Dr. Parker has been leading that office since 2015. And fast forward, just last week, the National Academies released a new report on understanding the well-being of LGBTQI populations that was sort of a decade later revisiting that charge by the Committee on Population to take a view that's expansive beyond just health, to look at the broad spectrum of well-being. And I was on the committee that developed that report, and I was super proud of it. It just came out last week. And I think it's the kind of the second piece that it really built from the 2011 report groundwork, and is kind of the next, to me, generation of thinking beyond just health status. Of course, health status is critical, but to look at sort of all of the dimensions, the social, legal, family, policy, education aspects of the well-being of LGBTQI populations. So check that out, and I think I'll put that in the link to that in the chat. But we're especially excited to have Dr. Parker here to like wrap up the pop-up. We'll talk about life at NIH in the grants process, about her role leading the Sexual Gender Minority Research Office. And then I think also we'll talk about the strategic plan for NIH on the health and well-being of sexual gender minority people. So we're really pleased to have you here. Thank you for being here for our pop-up. And I will turn it over to you, Dr. Parker.
Great, thank you so much, Stephen. I'm so excited to be here, and I really appreciate the invitation. So let me just, Dr. Norwood, it looks like I'm unable to share my screen.
Go ahead and try it now.
The obligatory Zoom moment.
Got it, okay. Okay, great. So I assume everybody can see my slides?
Yes.
Okay, great. As Stephen mentioned, my name is Karen Parker, and I serve as the director of the Sexual and Gender Minority Research Office at the National Institutes of Health. My pronouns are she and her. And just as background, I did sort of take the perspective on this presentation that folks maybe didn't know quite as much about NIH. And so I'm really going to kind of walk folks through NIH, the grants personship process, but also SGM specific activities at the agency. So I'd first just like to acknowledge the team in the Sexual and Gender Minority Research Office. So without these folks, nothing I'm going to talk about would ever get done. And so this is an amazing team to be a part of. And so I really appreciate all the work that they do. So in terms of the objectives of the presentation, there's really, I think, three big take-homes. So one is to articulate the role of the SGMRO within the NIH. Two is to think about our strategic planning. So I'm going to talk about a strategic plan that just wrapped up at the end of September, and then also about our new strategic plan that we just released. And then at the end, I hope you'll have a little bit of a better understanding about the NIH grants making process. So I'm going to talk, like I mentioned, I'll provide an NIH overview, give a specific background and development of the office, talk about our strategic plans, and then I will give you kind of a sense of what does our portfolio look like in SGM Health. And then I'll talk about grants personship, some other related resources, and then of course thinking into the future, sort of where do I see us heading. So in terms of NIH, so for those of you who don't know, NIH is the world's largest biomedical research facility. Our mission truly is to conduct research, to provide support for research, to train research investigators, and then of course to think about how do we communicate all of the research findings to the public. So we are a government agency. We sit structurally within the Department of Health and Human Services. Our budget is, I think, just over about 40 billion. And we conduct research within our own laboratories at NIH in Bethesda and in a few other locations. About 6,000 researchers work within the intramural program, and that's about 10% of that $40 billion budget. And then the program at NIH that you are most likely more familiar with is the extramural research program. And so that's the program where we fund grants within academic medical centers and universities and research institutions across not just the US, but the globe. We typically fund about 50,000 grants per year to some 300,000 researchers at more than 2,500 institutions. So structurally, we have different institute centers and offices, and so you'll hear me talk about ICOs. Each one has a different mission and priorities. All of the institutes and centers have individual budgets, and there are a variety of ways that institutes and centers make funding decisions. And so this is the challenge, I think, at working with NIH, is that just when you feel like you get to know a specific institute, then you might want to apply for a grant at a different institute, and things don't always work exactly the same. So that can be challenging. So the Office of the Director is not just sort of our NIH director's office, Dr. Collins. It's a much larger place where a lot of the sort of central work of the agency happens. There is a division of program coordination, planning, and strategic initiatives within the OD, the Office of the Director, that's more programmatic. And that structurally is where the Sexual and Gender Minority Research Office fits. And that's really important, as you'll learn as I move through this presentation. And then this is just a schematic about the 27 institutes and centers. So you'll see that most of the ones, all of the ones in maroon do extramural grant making. So that means they are institutes and centers that have grant making authority, and they provide funding to the extramural research community. Some of these, there are 3 that have extramural programs but not intramural programs, so they don't have scientists within those organizations working at NIH. And then there are a few centers that don't have grant making authority, and those are things like the Center for Scientific Review, which is the office or the place that reviews applications that come in, the Center for Information Technology, which basically makes sure I can get on these Zoom calls and that everything's working at the agency. And then the other one is the Clinical Center, which is our very large clinical research hospital. So now I'm just going to talk specifically about the Sexual and Gender Minority Research Office. So I'm very happy that Stephen, in his introduction, mentioned this report. So in 2009, the National Institutes of Health commissioned the Institute of Medicine to do a report on the health of LGBT people. This was released in 2011, and truly, like Stephen said, this was the catalyst for basically everything that's happened at the agency since 2011. It had very broad support from across the agency. So 19 of those 27 components provided either financial or in-kind support for this work. And we really do think of it as sort of the first ever truly comprehensive report on LGBT health. So a couple things to note: it was focused specifically on health, unlike the report that was just released last week. And it also specifically excluded from the scope of the report persons with disorders and differences in sex development, or sometimes known as the intersex population. And so our office currently includes those populations within our work. And so that was a decision made after the report came out. What do we do? So I mentioned this grant making authority that a lot of the institutes and centers have. We do not have grant making authority. That is something that's given by Congress. And so we sit within the Office of the Director. I mean, you saw we're a small office, right? We're a team of 7 people. And our role is really to help coordinate these activities. And when the office was established in 2015, we were officially established in September of 2015. I think NIH was very mindful about not putting the office within one of the institutes and centers, because I think the fear was that if we did that, for example, if this office sat within the National Institute on Minority Health and Health Disparities, the concern was that the other institutes and centers might think, well, that institute's working on that, they've got it, so we don't have to worry about it. So what we really wanted to make sure was that we were working across the entire agency and helping the different institutes and centers really get an understanding of the intersections between their missions and sexual and gender minority health. So most of the institutes and centers tend to focus on disease areas. So Steve mentioned I worked for 14 years at the National Cancer Institute. We have the National Heart, Lung, and Blood Institute, the National Institute on Diabetes, Digestive Disorders, and Kidney Disease, I think is that one. And so, we want to make sure that all of these different institutes and centers are understanding sort of where the intersections are and why it's important for them to think about sexual and gender minority populations in their research. So we also represent NIH at conferences and events focused on SGM health research. Also, now that every day is Take Your Child to Work Day, I apologize. My son is, I believe, doing his phys ed class and is running circles around our house. So apologies if you can hear that. We also, and I think sort of one of the most important roles that we play at the agency is that we serve as a resource for the extramural research community. So we know, I think everyone at NIH knows, NIH is a very large place. It can be very intimidating for people. And, you know, so many folks, especially, you know, students and early stage investigators, they just don't know where to start. And so I constantly say to people, if you don't know where to start, please start with me. Right? So I am happy to connect people to the correct program officer within a specific institute or center. I'm happy to help people kind of navigate what is the right place or where could be the appropriate home for this work. So people can always reach out to me. I also, you know, I don't want people to just reach out to me about their research ideas. If people are kind of moving through the process of working with NIH and you find that there's something that's a barrier that's specific to SGM related health research or researchers, I want folks to let me know what that is, because I can't always change large policies and structures at NIH, but I will work very hard to do so. And we have been able to change some things because people have called and said, hey, you know, this is something that I've encountered and this is kind of not working at the agency. We also serve as a resource for the NIH community. So I like to think of ourselves at NIH as a service center. So I want to make sure that people know we exist and they know that we are just there to help, because what we want to do is make sure that the institutes and centers are understanding this work. No, Owen, I'm doing a presentation. Go, please. I'm so sorry. It's like I have so many conversations. I need this hour. So we really do think of ourselves as a service center, and we want to make sure that the people at NIH who want to figure out sort of how do we add questions into one of our large surveys about this, right, that they know that they can come to us and get the help that they need. We convene conferences and workshops to inform priority setting and research activities. So I will say we're very mindful when we want to pull together a group of experts to do a scientific workshop. We're very mindful of asking the question, if it weren't for our office, would this happen? And if the answer is yes, then we don't think this is something that we should be leading. So for example, we're most likely not going to be leading a large scientific workshop that's focused on cancer in SGM populations. Our expectation is that the National Cancer Institute should be doing that and that we would be supportive. So we're thinking about doing things that if it were not for our office, this would not exist. And that tends to be more cross-cutting issues where there's not a specific home at the agency for that work. We also, of course, collaborate across the agency on the development of reports. We manage information dissemination about this work through mostly our website and also our SGM listserv. If you're not a part of our listserv, I would highly recommend you join if you're interested. And then we always think about leveraging resources, right? So we're a very small office in the Office of the Director. And so we're constantly thinking, how can we contribute to things and be a part of things that the institutes and centers are doing? And how can we encourage the institutes and centers to support us when we're doing activities? And so rarely do we do anything that is just supported by the Sexual and Gender Minority Research Office. And that, I think, has been really helpful, particularly when you think about things like buy-in across the agency. So how do we accomplish our goals? So we have a couple of really important groups that we work with on a regular basis. So the Sexual and Gender Minority Research Coordinating Committee of the NIH has representatives from across the institutes and centers. This was the very first thing that Dr. Collins did right when the IOM report came out in 2011 was he basically said, we need to figure out what we're funding at the agency. And so he pulled together a group of folks from across all the institute centers and offices. I was at the National Cancer Institute at the time, and truly I was jumping up and down, screaming, pick me, pick me. And most people don't scream, pick me for another committee at NIH or anywhere really. And so I began this work in 2011 with that committee. At the time it was called the LGBT committee. About a year later, after we presented an original portfolio analysis to Dr. Collins, which basically was an analysis of this is what we're funding, Dr. Collins, who's still the NIH director, basically said, okay, well, we need to make this group a longstanding permanent committee at the agency. And at that time, the group came together and decided that we felt that including persons with differences in sex development, and those who identify as intersex was important to include with this work. Now, we know that there are challenges with inclusion, right? We know that there are very differing concerns, but there are also some overlapping concerns. And my perspective is, if not here, then where? So there will never be an office for intersex research at NIH, right? It is a fairly small population. And so if we can include that work within our office and help to promote it and support researchers who want to do that work, then I think that in the end, that's a benefit. So we also work, also that coordinating committee, we do come together once a month. As director of the office, I now co-chair that group along with one of the representatives from the National Institute on Mental Health. And we come together once a month, and that's an incredibly active committee. And it is how, especially before we were able to hire more folks, it is 100% how we got work done within the agency. So we really work to communicate to them and to get information from them. And they're the ones who are advocating constantly at their institutes and centers for this work. So truly an amazing group of people at NIH who I get to work with all the time and who are really working for SGM populations within their specific ICOs. We also have a working group. So the Sexual and Gender Minority Research Working Group is a working group of the Council of Councils. So each institute and center at the agency has an advisory council, and those are made up of extramural folks. Those councils do things like come together a few times a year, and they're a part of the funding process at NIH for extramural grants. And so our division, I mentioned earlier, the Division of Program Coordination, Planning, and Strategic Initiatives, we have a council that's called the Council of Councils. And that's because the work of our division really spans the work of all the other councils. So many of the people who are on the Council of Councils have served on previous councils within the institute centers and offices. And so we have a working group of the council, and that working group comes together, and they're the folks who we rely on from the extramural research community to provide advice. I would like to say that one of our current members of the working group is Dr. Alan Mallory, who was actually from UT Austin, who is now at Ohio State. And so we really rely heavily on that group. And it's really amazing to work with them to better understand what's happening within the extramural research community. We also do several sort of cross-agency collaborations within the federal government. So I co-chair the HHS LGBT Coordinating Committee, and that's another group that comes together monthly to think about, what's happening within LGBT health and well-being across the department. And then I also co-chair the Measuring Sexual Orientation and Gender Identity Research Group of the Federal Committee on Statistical Methodology. And if that doesn't sound like a lot of government stuff, I don't know what does. But that group is really cross-departmental. So it's not just the Health and Human Services folks. These are people from Department of Education and Department of Justice and sort of across the board who are coming together to make sure that we're thinking about how to do this work correctly from a federal government standpoint. So, I mentioned that originally we were the LGBT coordinating committee, and then at NIH we became the LGBTI coordinating committee. And then in very early 2015, the coordinating committee sort of did some soul searching and thinking about the way that we were representing ourselves. And what we felt like was that the work of NIH really, we needed to be communicating in a way that was as inclusive as possible. So we also noticed that the literature in many ways was moving to this language of talking about sexual and gender minority populations. And so in early 2015, that's what NIH did. So all of this work became work about SGM communities. And last August of 2019, we released an updated definition of sexual and gender minority populations in terms of how NIH defines this work. And so I'm not going to read this definition to you. It is on our website. No additional populations were added, or no populations we were concerned with were taken away at this time, but we did update the definition to hopefully be as inclusive as possible and to make sure that folks saw themselves within our work. So now I'm going to talk a little bit about the strategic planning that's happened at NIH around this space. So we had a previous strategic plan that went from fiscal year 2016 through fiscal year 2020. This was developed by that coordinating committee. So this all happened before the establishment of the Sexual and Gender Minority Research Office. This plan was released in September of 2015, so right before the new fiscal year. And I'm just going to quickly go over what those goal areas are that we've been working on for 4 years, and then talk about some of the key accomplishments. So goal 1 was to expand the knowledge base. This makes sense, right? We're a research institution. That's what we want to do. And so, you know, we did several things over the past several years related to this, including putting out funding opportunity announcements. I'm going to talk more about those later, that were specific to sexual and gender minority health. And so that really helped, I think, kind of bolster the field. Goal 2 was to remove barriers to conducting, planning, and reporting on this work. And Objective 1 under Goal 2 was to establish the Sexual and Gender Minority Research Office. So I think with the hope that we would be a place at NIH that would be sort of looking around and making sure that the barriers that were being noticed to doing this work could be addressed. Goal 3 was to strengthen the community of researchers and scholars who conduct this work. And so that means really a couple of things, thinking about how we can better support anybody who's doing SGM related health research, right? So thinking about things like grantspersonship talks, thinking about things like connecting people to the correct program officers. But the other thing that we're really interested in is what's happening within the scientific community for individuals who identify as a sexual or gender minority, regardless of what it is that they're studying. And so we're interested in better understanding sort of science as a place that can be nurturing and affirming for folks. And we want to make sure that we aren't losing, you know, quality interested researchers, basically because science, we know anecdotally, can be very tough for people. And so we really think of it in a two-pronged way: those conducting SGM research regardless of identity, and researchers who identify as a sexual or gender minority. And then Goal 4 is to evaluate progress on advancing this work. And so one of the ways that we did this was each year we have released both a portfolio analysis that basically goes over sort of, this is what the portfolio looks like, the different institutes and centers that are funding the work. And then also a companion document that we call an annual report. And that captures sort of all of the other things happening at the agency that aren't strictly funding grants. And so all of those reports are on our website, and I would encourage you to go check those out if you're interested. So in terms of accomplishments over the past several years, we have seen an increase in the number of NIH-funded SGM research projects. We'll talk a little more about that soon when I highlight our portfolio. Our office has held a couple of scientific workshops. I mentioned that we typically don't do that unless it's a topic that we know is sort of cross-cutting. So we held a workshop in April of 2018 on methods and measurement in SGM health research. And then last September, we held a workshop on bisexual health. And so we know those are both topics that are incredibly important across all of the institutes, centers, and offices at the agency. I mentioned we don't have grant making authority, but we can co-fund projects. So in 2015, we started an administrative supplements program focused on SGM health research. And so we've actually had a lot of success there. We have funded alongside the Institute centers and offices more than $6 million and more than 60 supplements over these years. And it's been really great to see lots of kind of new people who weren't necessarily in this field working apply for administrative supplements so that they can include these populations within their work. In October of 2016, the NIMHD director, Dr. Eliseo Perez-Dabla, officially designated sexual and gender minority populations as a health disparity population for research. And so, you know, that I think was really important. I hear anecdotally all the time from folks that that designation really validated their work within their institutions and with their colleagues. And so we know that designation was also quite important at NIH. So as we think about health disparity populations now, sexual and gender minorities are always included. And so that was something, that was a big accomplishment at the agency pretty early on. We know that sexual orientation and gender identity questions are critical, that if we're not asking the questions and collecting the data, then we're not going to be able to understand what's really happening in the population. So we have incorporated these questions into the Phoenix Toolkit. No, yes, fine. Into the Phoenix Toolkit. And if you don't know what the Phoenix Toolkit is, that is something through the National Human Genome Research Institute. And it's basically a collection of validated measures that experts within the field come together to evaluate. So it's a way for people to kind of go and find measures across a variety of things, including demographics. And so within the demographics piece of the toolkit now, we have sex assigned at birth, gender identity, and sexual orientation. Those, I will say, are currently mirroring the All of Us research program. The All of Us research program is asking those questions within their very large longitudinal personalized medicine program. The questions are great for that purpose. They're not particularly great for sort of every single day, how to ask these questions on a large survey. They're very comprehensive with lots of cascading options, which is really important and great, but not always feasible. And then finally, we did several years ago start an investigator awards program, and that was really to sort of highlight exceptional early stage investigators within this field who were making significant contributions. And so every September we have held an awards program where we've recognized 2 ESIs, and then last year we added a distinguished investigator award as well. And so we've given 2 distinguished investigator awardees, and that's really, I think, to just demonstrate that NIH is serious about this work and that we're valuing the principal investigators out there who are conducting SGM-related health research. So now I'm going to move forward and talk now about the strategic plan that we just released on September 17th. So this is really just to demonstrate to you all that we really thought deeply about the planning for this new strategic plan, and that we also collected input from a variety of stakeholders. So we started internally at NIH. We worked with our coordinating committee and some other key stakeholders within the agency. We worked very closely with the research working group on developing some draft scientific theme areas and operational goals. And then we did go out to the public with a request for information so that we could get a sense sort of where does the public think this work at NIH should head. And then we, of course, worked with the NIH leadership, not just within our division, but across all the institute centers and offices. And we obtained NIH leadership approval, so approval from Dr. Collins this summer, and officially released the report just last month. So the new strategic plan, as I mentioned, focuses on FY 2021 to FY 2025. This is not a strategic plan for the Sexual and Gender Minority Research Office. This is a strategic plan for the entire agency, and this is something that I remind the institutes and centers all the time. It does, while it is sort of for the entire agency, our office leads implementation. And so it does serve as kind of a roadmap for us as we think about our priorities and our strategic collaborations as we move forward. So this plan has 4 major components. And so we highlight some overarching considerations that I think folks felt like, you know, when you're doing SGM related health research, these are the kinds of things that you might want to consider. We also talk about some scientific themes and research opportunities where we know there's a lack of research. And then we move into operational strategic goal areas, and those are very similar to the goal areas from the previous strategic plan. And then finally, of course, we highlight how we're going to sort of manage and be accountable for this work. So the overarching considerations span sort of several issues. So one is sort of the understanding that we need to be considering issues related to intersectionality. We talk about other key life situations that may be important to incorporate, and those are things like persons experiencing homelessness, military service, interaction with the foster care system, those kinds of issues that we know in many cases might be salient for some members of the community. Of course, we're concerned about this work across the entire lifespan. And so making sure that we're thinking about work that's not just maybe on adolescents and young adults, but also sort of throughout the lifespan, including the elderly. And then in terms of thinking about SGM subpopulations, so we know that just lumping all SGM people together in one category is not necessarily useful. And so really encouraging people to make sure that they're looking at their data by subpopulation, because we know that there are many in-group differences. And then finally, we highlighted some relevant research strategies. And those are things like community-based participatory research and trauma-informed research. And so those are things that we highlighted in this report as sort of major considerations that we think people should think about prior to conducting this work. And then in terms of scientific themes and research opportunities, admittedly, these are quite broad. We certainly know that we need more clinical research and more intervention-related research to happen within this space. Most of our portfolio is in social and behavioral research, and so we know that that's sort of a key component of this work. And then we also know that there's lots of lack of data about chronic diseases and comorbidities, right? So there's lots of areas where we just haven't started to look at any of the data, and folks doing research, for example, within cardiovascular disease or diabetes or hypertension, you know, may not be thinking about, oh, there could be differences in the sexual and gender minority community. So we're really encouraging people, I think, within those spaces to make sure that they're collecting data about sexual orientation and gender identity so that those areas can be looked at. And then, of course, methods and measurement research, I think, is always really critical. And you'll learn more sort of about what's happening in terms of measurement later in this presentation. So finally, in terms of the operational strategic goal areas, so goal 1 is still sort of to advance rigorous research on the health of SGM populations. I will say now, though, after this first 5 years of the office, we are really now thinking about how can we expand and move more into the intramural research community and think about how we can work better with those principal investigators to make sure that when appropriate, they're thinking about SGM health research. And so this goal 1, I do think, has been a little expanded since the previous plan. Goal 2 is to expand SGM health research through fostering specific partnerships and collaborations, not just internally, but also externally to the agency. And so we're thinking about that and how we can better work with our federal partners, and then, of course, other sort of community-based organizations. Operational goal 3 is to foster a highly skilled and diverse workforce in SGM health research. And so again, this sort of mirrors our previous goal 3, but we know that because this is a nascent field, that we have a lot of work to do, and that there are lots and lots of needs in terms of people establishing quality research networks and mentoring relationships. And so this will continue to be a very important goal area for us. And then operational goal 4 goes back to sort of this data collection issue that we want folks to be encouraging. We want to be encouraging data collection related to SGM populations and research. And then the other piece is that we really need to figure out better understanding what's happening in the biomedical research workforce. And so we are thinking about ways to make inroads there and thinking about our some strategic collaborations with the National Science Foundation so that we can better do that to understand what's happening in the scientific workforce. So now I'm going to talk about the SGM grants portfolio. So this just will give you a general sense that over the past several years, our research portfolio has been growing, which is really great. This also shows sort of the breadth of the different institute centers and offices that are funding this work. So I realize you most likely don't know all of those acronyms at the bottom. I barely know all of those acronyms at the bottom, but it just basically says there really is broad support for this work across the agency. One thing I would caution everyone about, though, is that I would not, for example, look at this slide and say, well, the National Institute on Neurological Disorders and Stroke, that's the NINDS, they've only ever funded this one grant in the past 5 years. You know, they must not be interested in this work. The truth of the matter is NINDS is very keenly interested in this work, but the challenge is that they're not getting a lot of applications, right? So I always say to people, we can't fund what we don't get. And so I would never, ever make an assumption that a specific component of NIH is just not interested. So in terms of just FY 2019, which is the most recent year that we have data for, we funded 413 projects, and you can see here how these sort of fall out. So the National Institute on Mental Health, followed by the National Institute on Drug Abuse, and the National Institute on Child Health and Human Development funded the most numbers of projects. Now, it's really important for us to pull out the non-HIV/AIDS projects because our portfolio is very heavily HIV/AIDS related. And so when you do that, you basically get 156 projects. And this is where you'll see how these break down. So this really changes sort of the landscape of who's funding this work. So NICHD, which is the National Institute on Child Health and Human Development, followed by the National Institute on Minority Health and Health Disparities, and the National Institute on Drug Abuse, are funding the most number of projects within this space. And then as we look at disease areas and health conditions, so I noted that HIV/AIDS is a very big portion of our portfolio. So we currently 62.2% of the portfolio is HIV/AIDS focused. In 2015, when the office was established, that percentage was 73%. And so what we have wanted to do in the office, because we know the HIV/AIDS work is very critical, and that honestly that will continue to go. There's a lot of support for that work at NIH. What we really want to start to see is a more balanced portfolio. And so we are headed in the right direction because we know that there are so many other issues related to individuals' health that go beyond HIV and AIDS. And so we really want to encourage people to think about SGM health research beyond HIV/AIDS. And, you know, we know that there is a historical reason for these very high percentages of our portfolio being focused in HIV and AIDS, but we really want to see more research sort of across the board. I mentioned that the chronic diseases and comorbidities are really a priority in our strategic plan. And so I'm hoping that that will sort of help us see these numbers adjust so that this portfolio doesn't look like this in another 5 years. So in terms of NIH grant type, so I think the key sort of takeaway here is that 60% of the work is in research projects. And so those are the things that you most likely know about, the R01s, the R21s, the R03s, right? These, particularly the R01s that are these very large research projects that folks are doing. And then we do have several projects that are related to training. So we have, you know, people who are getting F awards, people who are getting career awards, the Ks. And so, you know, I think that this really just demonstrates that we are working to sort of do this training and then also to fund the basic research. And then I would say my biggest concern with this slide is the lack of institutional training grants. Those are the T32s. And I think that the field in many ways needs more of those so that there are these sort of opportunities for pre-docs and postdocs to come together who are doing this work. The challenge there has really been the way that the institute centers and offices have been established and siloed by disease area or health condition. And so we have very few institutes or centers that are focused on population-based groups, and the ones that don't support T32s. And so this has been a challenge within our office that we are constantly thinking about what's the role for us to play here. So just in terms of the portfolio analysis key takeaways, so between 2015 and 2019, we did see a 37.2% increase in the number of funded SGM-related projects. I'm really proud of that accomplishment. I think that's a substantial increase, but we know that we have so much more to do in that space. We've seen a 58.4% increase in total allocated funding. I will say that the funding dollars in many ways can get reported in inconsistent ways by year, depending on some of the larger projects that go for multiple years. And so that is one of the reasons why the percentage of funding and the percentage of projects doesn't exactly match up. We've also seen a 92.5% increase in the number of non-HIV/AIDS projects. And so that's also something that we've been working on. And so I'm quite proud that we are moving in the right direction. Also, 21 different NIH institute centers and offices have funded this work. And so this is something that is a cross-agency effort. And then I also mentioned this sort of lack of institutional training grants, which I think is sort of the next big hurdle that we in the SGMRO need to figure out. So now I'm going to start talking sort of more generally about grants personship at NIH and less about sexual and gender minority specific work. So I'm going to do some stuff that's really basic because I think a lot of these things can be confusing and there's a lot of acronyms. I've been using probably too many acronyms already. But funding opportunity announcement. So that's the phrase that we use. That's the global phrase that we talk about. We call those FOAs when we're talking about basically when the agency puts out an announcement to the research community that says, hey, we're interested in research within this space, right? That's the FOA. If you want to find out sort of how do I learn about what these are, there's a grants.gov, and then I think, and that's sort of all grants across federal government. But if you're really interested in what NIH is putting out, you really want to go to the NIH guide for contracts and grants and contracts. And the guide puts out things every single day. But you can get one of the consolidated emails every week. It comes out on Friday afternoon. That's how I get my guide information. And it's typically not incredibly long. You know, you can skim through it in maybe 30 seconds or a minute, right? And see, is there anything that's just come out that's relevant to me that I need to take a look at? The different funding opportunity announcements are always issued by like an institute center or office. And then, so there's like a main component of the agency that's putting it out. And then there are often participating institute centers and offices. So if an FOA goes out on the street and say NIMHD puts it out and the National Institute on Mental Health and the National Institute on Drug Abuse partner and our participating ICs, those are the only 3 institute centers or offices that are going to be accepting applications through that specific FOA. The FOAs include broadly what are called program announcements and then also requests for applications. So I'm going to talk about what's a PA, a PAR, a PAS, and an RFA. So you'll hear people talk about these all the time. So program announcement, those are announcements that NIH puts out that are pretty broad, that express, hey, NIH has an interest in X, right? It's not particularly prescriptive. So for example, we have a current PA that is out on the street for research on the health of transgender and gender nonconforming populations. Now we talk about sort of examples of research areas that we're interested in, but it's quite broad. Typically a program announcement has specific standard receipt dates. And so you have to pay attention, like when is this due? They're typically active for several years. So once you see a program announcement come out for the first time, typically that expiration date is several years down the road. And then there are specific kinds of program announcements. So there are PARs, and those have a special receipt, referral, or review consideration. So sometimes people will put out a PAR, and maybe the review considerations is that they'll be reviewed in-house at an institute or center and not through our larger Center for Scientific Review. And then a PAS is a program announcement that's broad and might have several receipt dates, but includes specific money that's set aside. So the program announcements don't typically have money set aside, but you might have lots of institute centers and offices that sign on to say, yeah, we're interested in this space, and so let's see what comes in, right? Let's put this out and see what kind of applications we get. And then there are requests for applications, or RFAs, and those tend to be much more narrow in focus and scope. They also will have set aside funding. So for example, we signed on for co-funding to an RFA that came out last December that was an R21. So only R21 applications could come in, and those were specific to SGM measurement. And so there was one receipt date, and now that's gone. And all of the institutes and centers that were signed on put aside money to specifically fund those projects. So I mentioned the single receipt date, and then those are typically reviewed by a scientific review group that is unique to the RFA. So those typically don't go to one of the standing study sections that meets, regularly. they will pull together a group of experts specifically to look at RFAs typically. So this is just sort of what I just told you, but in a different format, right? So I mentioned the program announcements and the requests for applications. There is one other thing that is really critical for folks to know, which is this concept of parent announcements. And so while you can have program announcements and you can have requests for applications, for example, for RO1s and certain things, there is also an RO1 parent announcement. And so those are for basically what we call investigator initiated or unsolicited applications. So you're a researcher out in the field, you have a great research idea, and there's not an actual call for that kind of work at NIH. That's fine. It's not that you can't apply, it's just that you'll come in through these parent announcements, and they're incredibly broad because they're really there to just accept research that wouldn't fit within one of these other program announcements or RFAs. So NIH over the past couple of years, for those who do a lot of this work and pay attention, you will have noticed that we're actually putting out a lot less program announcements and more what are called notices of special interest. So we had a program announcement on the health of SGM populations, and when that expired, instead of doing another PA, we moved in the direction of a NOCI, which is sort of policy-wise what NIH is wanting folks to do. And there's a couple of reasons why. So I mentioned it's sort of this alternative to reissuing one of the non-parent program announcements. And one of the reasons that they did that truly is the burden. So developing a program announcement as a program director is a really big lift. And the notices of special interest are much less sort of burdensome. So you can develop a NOCI fairly quickly. They do not have expiration dates, which is quite nice. And they don't limit the different mechanisms that you can come in, which is great, right? So we now have a NOCI out on the health of SGM populations. So you can come in through any of the parent announcements or other program announcements that might be relevant and refer to this NOCI that says NIH has put out this NOCI that they're interested in this work. So of course we will continue to use like the RFAs, the PARs, and the PASs, but this is really first a lot of those program announcements that were basically saying the same thing scientifically as a NOCI, but had a lot more detailed information and took a lot more work. So this is just a schematic of the NIH grants process overview, and this is really to kind of tell folks this is a really long process, right? So by the time you apply, it can really be 9, 10, 11 months before an actual award is made. And so this is to basically say there are lots and lots of steps within this process. You know, I would say be patient and maybe have several things going on at the same time. So now in terms of how at NIH do we attempt to help the research community and principal investigators. So every institute and center that funds grants has program officers. And so those are the folks who kind of, they hold or oversee a portfolio of funded research grants. And they also work with people who aren't yet funded. So if you have a research idea and you find a program announcement or an RFA and you're interested in applying, one of the very first things you're going to want to do is talk to a program officer, right? So once you have some specific aims developed and you've started to think about what would this project look like, you want to contact a program officer because their job is to advise folks. They have access to a lot of knowledge that's not sort of readily available. And they also were the folks who were convening and attending meetings to identify research gaps within their fields of expertise. And they also work very specifically alongside the other science folks at their institutes and centers in terms of planning. And so they really understand what are the priorities of our institute and what are the priorities of our director. So how do they help? They can talk about the relevance of your research idea to their institute and center. So they can say, yeah, this would be a great fit for us. Or, you know, as it's written, that's not a good fit, but if you tweak it like X and Y, then it might be a good fit. They can also recommend other institutes and centers that could be a good fit for you. They can talk about what the best research mechanism for your project might be. So you might come in with something that you think is an R21, and they might say, you know what, this is actually a bigger project than that, and you should apply for an R01. So they can give those kinds of hints for folks. They can also talk specifically about the funding opportunity announcement that they feel would be appropriate to apply under. And they also have a pretty good sense of the study sections within review, and can really sort of say, like, this is where we think this application is most likely to be reviewed, and or this might be a good study section for you to request in your cover letter. So in terms of contacting program officers, so I would just say a few things. Remember that program officers, it's their job to talk to you. And most of them have this job because they love science and because they want to talk to you about your science, right? So how do you figure out which program officer to contact? So there are several ways to do this. Every funding opportunity announcement at the end, and this includes NOCs, at the end of the opportunity, there will be a list of scientific contacts. It will give people's names, sometimes their phone numbers, always their email address, by institute or center. So you'll kind of know, like, oh, this is the main contact at that institute for this FOA. You can also look at institutes' websites and figure out sort of, well, what would be the right division, and then who within that division is focused on in this space. And then you can also look at NIH Reporter, and that's a tool I'm gonna kind of quickly show you in a couple of minutes. And that's the really large outward-facing website at NIH that allows anybody to go onto this website and look at what's NIH funding, how are we spending our tax dollars. So lots of questions we get are things like, can I contact more than one program officer? And the answer is sure. But I think in general, program officers feel like maybe start with one at an institute. Certainly you could go to another institute, so you can contact several institutes at the same time, but I wouldn't recommend contacting several program officers in the same institute, because those are the folks who are kind of working together and communicating, and they will kind of figure out who is the best place. And then when should I contact a program officer? Early and often is what I would say. I mean, certainly connect with the program officer, make sure that they sort of feel like you're on the right, the right track, and that they're the right institute or center that you would want to be applying to. And then how should you reach out? I think by and large, folks want to have an email. And I would also say, you know, they typically would like to see a specific aims page beforehand. So I would recommend emailing, providing your specific aims page, and then asking if they have a time that they could connect with you. And so that way people, I think, feel like they're prepared for the calls, and they can really be able to assist in a better way if they sort of know where your research is heading. So in terms of some general tips, search Reporter for projects that are sort of within the same area as yours. I will talk a second about that. Always talk to a program officer. Talk with a scientific mentor. And so that, you know, certainly I think if you're at UT Austin, there are going to be really amazing researchers there who can hopefully help. I would say watch for new concepts being cleared for development. And so all of those advisory councils that I talked about, that is also where program officers go and get concepts cleared. So before a program announcement or an RFA or a NOC is developed, those have to be cleared through council. And so if you see that somebody's presenting to council on a concept and all of those concept clearance presentations are open to the public and video cast, you can kind of see, oh, this is kind of where this institute or center is headed. And it kind of gives you a heads up for what might be coming down the pike in terms of an RFA or a program announcement. And then, you know, we talk a lot about sort of internal peer review, thinking about both your aims and your application. How can you sort of shop that around with your colleagues at your institution so that you can get feedback before you're actually submitting to NIH. This just gives a sense of the training and career timeline. And so, you know, we have sort of several different mechanisms in place for folks that are sort of across the board. And I would say, you know, I mentioned the T32s, which are these institutional training grants, but then we also have these F mechanisms where people can get funding for working, for example, on their dissertation. And then of course, as you move sort of through your career, there's a variety of different training options. Those are all listed on the bottom. And then you can kind of see at the top where you're sort of starting to develop things like R03s and R21s and R34s, which are different types of research grants. So then in terms of common mistakes, these are things I hear from program officers, that folks don't allow for enough time to prepare a grant application. You know, don't send it to the folks at your institution the day that it's due, because there are a lot of things the institutions have to do. Applying to an inappropriate announcement. So NIH has some announcements that are for clinical trials and others that are clinical trials not allowed. And so you want to make sure you're applying to the right announcement. I would say just ignoring the details. So ignoring page limits, expiration dates, updates. So oftentimes there'll be an update to a program announcement. And if you're not paying attention to the updates that officially come through the guide, you might miss something, and then you might be applying to something that, for example, you're no longer eligible for. Again, really reading the entire funding opportunity announcement carefully, putting important information in an appendix or another attachment. And then of course, contacting a program officer too late. So if you contact a program officer on Monday and your application's due on Friday, there's truly not that much that they can do to help you. Here's a list of grant writing resources. And I'm happy to share these slides with Eliza if anybody wants them to access these live links. And then this is just a general overview of NIH Reporter. And so this is what this tool looks like. And I'm just going to quickly go through sort of how you would find the sexual and gender minority related projects at NIH. So we have what's called an NIH spending category. There are many, many of them, more than 200. And the key here is really that those spending categories don't work until what we say the data is frozen. So for example, the most recent data you can currently get using the NIH spending category is 2019. So if you go in and search for active projects, you can use the open text search, and you can search by principal investigator and many other things and find things that have sort of just been funded. But if you want to use an actual code, then you have to go back to where the data is frozen. So this is just an example. If you want to look at what was funded in SGM Health Research in 2017, if you scroll down, you'll see this thing called NIH spending category. And then if you click on SGM, a list of projects will come up. So in 2017, we funded 379 projects. And then each one of the projects is listed, and you can click on the project and you can get the abstract text, you can get the public health relevance, and then you can click on details. And this is a really interesting thing. You can see who the PI is, what their title is, what their institution is, and then where this arrow is pointing is the program officer, right? And so you can go into Reporter and find studies that are kind of similar to yours, and then you can find, oh, who's the program officer on that funded project? And then you can kind of know, oh, maybe that's a program officer I should be contacting. So now just a couple of specific SGM related resources. So this is our website. If you've never been there, I would encourage you to check it out. And so just a couple of things I want to highlight. We have a new page called Research Resources, and this is where we're trying to pull together content from sort of across NIH that's specifically relevant to people doing SGM related health research. So we have things like the difference between minority health populations and health disparity populations, right? That can be really confusing for folks. We have links to that. We have links to the FAQ on the Office of Extramural Research that talks about how do you capture transgender and gender nonconforming participants in enrollment tables. Now, I'm going to tell you that FAQ is particularly unsatisfying. So we have a lot of work to do there, but it does tell you sort of when you have this quandary, because the enrollment tables are so antiquated, what do I do? And so I really encourage folks to go to this one. And then as a part of the research resources, we have a specific page that highlights methods and measurement. So we've got related publications here. We have our report from our methods and measurement workshop that we held in 2018 that highlights research opportunities. We have examples of the way that different federal agencies are asking these questions. So, you know, I would just say if you're interested in measurement and methods, please check out this website. And then finally, Stephen mentioned this report that just came out last week, Understanding the Well-Being of LGBTQI+ Populations. So this was co-funded by our office. And I mean, Stephen mentioned this, I really did think of this as sort of the follow-on to the 2011. And I was really happy to see the interest at the academies of making this much broader than health, because we know that, you know, people's health is not in a silo. And so we need to understand what's happening within all these other domains and facets of life. And so this report has been released. And so it is on the National Academies of Science, Engineering, and Medicine website, and you can download it for free. And so I encourage you to do that if you are interested. And so finally, this is my last slide, sort of where are we headed into the future? So specifically for our office, so we are holding an SGM specific listening session on November 19th. So we've invited some people from key stakeholders to come to the table, and truly they have like 5 minutes to kind of tell us what's on their mind. This will be video cast or WebEx, so people can register and listen in. And then of course, if people have comments about this work and they want to provide that to us, we always take public comment. You can always email the office. We launched a scientific webinar series this past summer. And so we've held 2 scientific webinars. Those are really highlighting SGM research that's funded by NIH. We've had 2, they're both posted on our website, and we have a 3rd one coming up on December 3rd. And so if you're interested, those things do get announced via our listserv. We're holding another scientific workshop that's specific to violence against SGM populations. So again, another really sort of broad category that has substantial impact across several institute centers and offices at NIH. And so we're currently in the early stages of planning for that. We're establishing an SGM scientific interest group at the agency, and that will largely be within the intramural research program. But I believe that that might also be open to extramural researchers. And so as we figure out what that's going to look like, we'll also announce that to the extramural community if that's going to be something that we really want to sort of bring people together in. But we're trying to really increase interest in this space internally at the agency. And then finally, we are working to finalize plans for another National Academies of Science, Engineering, and Medicine report, this one specific to measures. And so I talk a lot about measurement in this space, and it's really, really critical to conducting quality research. And so one of the challenges is that a lot of people come to me and say, well, I want to incorporate measures. Which ones do you recommend? And NIH really doesn't make recommendations. This is one reason why we developed our methods and measurement webpage. It was to sort of provide all of the data and all of the different examples about how people are doing this so that people could go and kind of figure out what was best for their needs. But I think at this point, because we really want to be encouraging data collection, and I think the long-term goal would be some kind of a directive from the Office of Management and Budget that would make this data collection standard, we really need to come up with some measures that we feel comfortable recommending. And so we're asking the academies to bring together experts to come up with across several domains, a non-binary sex question so that we can capture this like the intersex population and persons with differences in sex development, and then also questions related to gender identity and sexual identity. We want those not just questions that would be appropriate, for example, in a large national survey, but we're also interested in getting recommendations about what would be appropriate in the clinical space and also in administrative data collection. So we know that we need to be asking these questions in HR data, in grantee data, for example, so we can understand what's happening in the research community, but the questions across those 3 areas may be different. And so we also know that having standard questions is challenging, right? So terminology evolves. And we want people to be able to feel comfortable answering questions, right? And we also know that a question you might ask in an adult population might not be the appropriate question in an adolescent population. And so we know that people will need to adjust measures at times. And so because of that, we're also asking the academies to come up with best practices. So basically, if these are not the measures that are appropriate for you to use, keep these things in mind as you adjust them. And so we're really excited about that project, and hopefully that will be underway within the next couple of months, and that we would have recommendations within 16 to 18 months after that. And then I think that's it. So I'm happy now to take any questions that folks have.